Have you ever felt a sudden, sharp burst of pain on one side of your head? Maybe it's an intense, throbbing sensation that comes and goes quickly, yet leaves you feeling drained and frustrated. SUNCT headaches can be one of the most confusing and painful experiences. They don't last long, but when they hit hard, right around the eye and temple, often making everyday activities feel impossible. So, what exactly is going on when you're dealing with a SUNCT headache, and what can you do to manage the pain? Let's dive into the details. What is a SUNCT headache? SUNCT stands for short-lived, unilateral, neuralgiform headache attacks with conjunctival injection and tearing. That sounds complicated, but here's what it means in plain language. Short-lasting, each headache attack is brief, usually between 5 seconds and 4 minutes. Unilateral, the pain happens on one side of the head. Neuralgiform, it feels like nerve pain, sharp and throbbing. Conjunctival injection, your eye may get red or bloodshot. Tearing, the affected eye often waters, adding to the discomfort. It's rare, mostly affecting men over 50, and while it's connected to the trigeminal nerve, one of the most pain-sensitive nerves in the head, doctors aren't sure why some people get it and others don't. However, we do know that it's a type of headache classified as a trigeminal autonomic cephalalgia, TAC, which includes other severe headache disorders. Symptoms of SUNCT headaches. When a SUNCT headache strikes, the pain can feel like a burning, stabbing, or throbbing sensation, typically around the temple and eye on one side. Unlike other headaches that may build up slowly, SUNCT headaches hit their peak almost immediately and then fade away, only to return throughout the day. Other symptoms might include red or bloodshot eyes, watery eyes, a runny or stuffy nose, pressure in the affected eye, a swollen eyelid, a sweaty forehead. Some people even experience a spike in their blood pressure during an attack. Why do SUNCT headaches happen? The exact cause of SUNCT headaches remains unknown. However, in some cases, they can be linked to underlying health issues. For example, researchers have noted connections to brain lesions, cysts, or tumors past trauma or injury, particularly to the face or head, strokes that affect the brainstem, blood vessel abnormalities, certain genetic conditions, like neurofibromatosis, rare cases associated with HIV. Sometimes, these headaches seem to strike out of nowhere. Other times, simple activities, like touching your face, chewing, or moving your neck, might set them off. Temperature changes, strong odors, and even minor shifts in the environment can also trigger an episode. Diagnosing SUNCT. If you suspect you're experiencing SUNCT headaches, diagnosis typically begins with a review of your symptoms. To confirm SUNCT, a doctor will look for specific signs: a pain pattern that affects one side of your head, focusing around the eye and temple. Short, stabbing pain that lasts anywhere from a few seconds to a few minutes. Accompanying symptoms like eye redness, tearing, or other autonomic symptoms. Since other conditions can mimic SUNCT, your doctor may also recommend imaging, such as an MRI, to rule out structural causes like tumors or lesions. How are SUNCT headaches treated? Treatment can be a bit tricky because SUNCT headaches don't respond well to standard headache or migraine medications. However, several approaches have shown promise. Some medications that may help reduce the frequency and intensity of attacks include anticonvulsants. These are often the first line of treatment. Medications like lamotrigine have shown some success in reducing SUNCT symptoms. Steroids, while not a long-term solution, steroids can sometimes help calm the inflammation associated with an attack. IV lidocaine. In extreme cases, intravenous lidocaine can provide temporary relief for severe attacks. However, this is typically used under medical supervision and is not a home treatment. Surgical options. If medications fail to control the symptoms, there are a few surgical options. Microvascular decompression. This procedure involves placing a tiny pad between a blood vessel and the nerve root to relieve pressure on the trigeminal nerve. Percutaneous trigeminal ganglion compression. In this procedure, a doctor applies pressure to a collection of nerves connected to the trigeminal nerve, providing relief for some patients. Deep brain stimulation, DBS. This involves implanting a device that sends electrical pulses to targeted brain areas, helping regulate pain signals. SUNCT versus other headache types. SUNA, a close relative of SUNCT, SUNA, or short-lasting unilateral neuralgia form headache attacks with cranial autonomic symptoms, is another type of TAC. While they share a lot of similarities, the main difference is in the autonomic symptoms. SUNCT usually involves tearing and eye redness, while SUNA can cause any range of symptoms and tends to last slightly longer. Cluster headaches, often mistaken for SUNCT. Cluster headaches have a few key differences. They tend to last much longer, up to several hours. They often occur at night. They generally respond to headache medications, unlike SUNCT. They might involve ptosis, drooping eyelid, and miosis, constriction of the pupil. Trigeminal neuralgia. SUNCT is sometimes thought of as a form of trigeminal neuralgia. However, while both involve the trigeminal nerve and can be excruciating, there are significant differences. Trigeminal neuralgia typically does not include symptoms like watery eyes or a runny nose. SUNCT is often resistant to the treatments that work for trigeminal neuralgia, requiring different medications and strategies. Living with SUNCT headaches. While living with SUNCT can be challenging, there are ways to manage your symptoms and improve your quality of life. Track your triggers. Noticing what sets off your headaches can help you avoid specific situations or activities. Stay informed, stay up to date on new treatment options, and talk with your doctor about any emerging therapies. Build a support system. Living with a chronic condition can be isolating, so reach out to friends, family, or support groups who understand what you're going through. SUNCT headaches may be rare, but knowledge is power. Understanding what's happening to you and the options you have for managing the pain can be the first step toward a better quality of life. If you're experiencing symptoms that sound like SUNCT, consider reaching out to a healthcare professional to discuss your symptoms and treatment options. Thanks for watching, and stay strong. You're not alone, and there is hope for relief.